Healthy Living. Yes, we are in the operating room here at Hilton Head Hospital, and I'm honored today to be with Dr. Jeffrey Rubin, and I'm really excited to see you. We've actually had about 30 minutes to kind of take a tour of everything here, and it is informational, it's fascinating, and frankly, it's very inspirational. So today, just so people kind of have an idea of what we're going to do, we're going to do two different segments. Dr. Rubin and I are going to chat a little bit about this wonderful system that you have, a little bit about the history, and then we're going to introduce you to your team. We're going to introduce everyone. And I think it will be fascinating and something that you don't often get to see. So, good to see you.
Great to see you. Thanks for coming.
I really appreciate your time in this. And again, what I've learned is I feel like my head is kind of exploding with questions. So let's go basic.
Sure.
First of all. Here in this operating room, can you just give me a lay of the land and an overview and when and what kind of surgeries you do with this equipment?
Sure. So we do spinal surgery. We'll do cervical, meaning neck. We'll do thoracic, meaning chest, and lumbar, low back. And we do surgeries front, side, or back, depending on what the patient needs. In the operating room, we wanted to show you some of the technology that we use. So obviously you have to make sure that you're doing the right surgery for the right patient for the right reasons. Once you've decided all those, these are tools that we use to achieve the desired outcome, which is obviously patient satisfaction.
So what we're going to do is we're going to talk a little bit about the toolkit that you use.
That's correct.
So let's go from the beginning. A patient comes in to see you, and you shared with me sort of the protocol that you go through to make a decision. I think it was fascinating.
Sure. So you want to make sure that you try and treat someone non-operatively first. That's standard medicines, physical therapy, braces, and everything that we usually do to keep someone out of the operating room. However, if you need spine surgery, and there are defined reasons why you need spine surgery, you want to make sure you have the right surgery first. It is very important that you get the job done. So I always talk to my patients, we try and figure out what the goals of surgery are, and we try and figure out the best way to achieve those goals. Once we set those parameters, then we want to do it in the least invasive way possible.
And what does that really mean?
Right, so you want to get the job done. And
okay.
Usually spine surgery involves decompressing or freeing up nerves or spinal cord. And then sometimes you have to stabilize the spinal segments because they are unstable.
Got it.
They can be unstable from arthritis, unstable from trauma, unstable from infection or tumors, or unstable because you had to remove enough structure to free up the nerves that we actually made them unstable, so we have to stabilize them. And the tools in the operating room allow us to achieve all of those goals.
Talk us through the tools that you have in here, because I think one of the reasons we really wanted to do this is you have state-of-the-art instruments, people who work with you, everyone.
Yes, we have A+ equipment, we have A+ team members. I have the same team every day that I operate, and that is so important for all aspects of patient care. So yes, so we have old technology. Everyone knows what X-ray is.
Right.
We have intraoperative X-ray. Now, some people bring in an X-ray machine. This is actually called a fluoroscope. So basically, this is an X-ray machine that we can use. We park it in the operating room. It allows us to take multiplanar, two-dimensional X-rays.
Okay.
Okay. This is an example of a patient that underwent a anterior cervical surgery. This is a two-dimensional image, and this basically shows where we removed the disc to free up the spinal cord and the nerves. We put in a spacer. We did it at two different levels, and then we stabilized it with a titanium plate and screws.
Okay, makes sense to me.
Okay, and then we have pictures of an intraoperative CT scan.
All right, talk to me about this. Yes, we do.
Okay.
They'll be seeing that as we talk.
Correct. So an intraoperative CT scan is a three-dimensional imaging technology, and so we have the capability of bringing in a CT scan. The patient's on the table.
All right.
It goes around the patient. It takes an intraoperative CT scan and allows us to do intraoperative three-dimensional navigation.
What's the advantage of that?
So it tells us exactly where we are.
Okay.
If people have unusual anatomy, if they have a scoliosis, they have curvatures, tumors, infections, or just small anatomy, unusual anatomy, it allows us to see all of that.
Okay.
Plus, we can see it without dissecting it, so it's less invasive. We don't have to remove bone and ligaments and all the stuff around it to see it. We can see it through our pictures.
Now, if I would be remiss if I didn't ask about robot.
Sure.
Because I think, again, that's
So
sort
the,
of
so
what
the
we hear.
robot is the next evolution of intraoperative navigation. So this is actually the Globus Excelsius robot.
I'm going to sneak here so I can really see too.
And this is a three-dimensional intraoperative navigation. And the advantage is it has a fixed trajectory.
Got it.
So this is just a patient's CT scan that we could get pre-op or intra-op. I prefer intraoperative because it's more accurate. And then these are just screws that we can place. So we design where we want to stabilize the spine, and this is all computer-based. And once we have the screws kind of exactly where we want it, we press a button. The robot moves the arm into the exact trajectory that will allow us to place that screw percutaneously through the skin, minimally invasively.
Are you basically here and your team is working around you and every?
Yes.
Okay.
So we have our radiology clinical lead that you're going to meet in the
Yes.
second segment. We have our spine clinical lead and my first assistant, and all of us are working together. Some of us are sterile, some of us are not sterile, and we work as a team together to achieve that goal.
What is if you were to say from a follow-up point of view or a recovery point of view, what are recoveries like from this kind of surgery?
Sure. Once again, I'm a big advocate of doing the right surgery first. So
Okay.
a lot of our patients have either pain or dysfunction. So you do spine surgery to help someone with pain and or dysfunction. If you help someone with pain and dysfunction, the recovery is quicker.
Yeah.
So
that makes sense.
And you want to the operation that you do, you want to achieve your goals, but you want to do it in the least invasive way possible, and you want to do it as accurate as possible. So these tools allow us to be less invasive and more accurate. So they allow us to do both.
It was interesting because you were talking about one of the cases that you did this morning, and the gentleman will be going home tomorrow.
Yes.
And I think I was rather surprised by that.
So some of these surgeries are actually outpatient surgery, which can be home the same day or home the next day. Both are characterized as outpatient.
Okay.
And then some of our bigger spinal surgeries stay a couple of days, 2 to 3 days.
I mean, I think it's fascinating. I think we're going to take a quick break. I know we've got a lot of people that we want to share and have them explain what they're doing. So stay with us. We'll be right back here on Healthy Living.